Hello, today we are going to see radiological science. I am Dr. Sahil Kathuria. Air crescent sign. It is a sickle-shaped lucency partly surrounding by the mass in a pulmonary cavity on X-ray and CT, classically seen in aspergillomas. Angel wing or bat wing sign. It is seen in pulmonary edema which involves the perihilar distribution and spares the cortex of the lung. So this is the bat's wing and it gives the appearance of bat wing because the consolidations by pulmonary edema are seen in the perihilar regions. Apple core sign. So this appearance of annular constricting carcinomas of the bowel, usually the colon, from circumferential involvement of the lumen. So because of the mass involves the circumferential bowel loop, gives the only annular lumen and it gives appearance of apple core sign. Bamboo spine. Undulating contour spine caused by the bridging syndesmophytes seen in ankylosing spondylitis. So these are the bridging syndesmophytes seen in the lumbar vertebra and it is a characteristic feature of ankylosing spondylitis. So it gives appearance of a bamboo spine. Beveled edge appearance. Asymmetrical erosion of the inner and outer tables of the skull usually seen with eosinophilic granuloma. So this is the erosion, that is a radiolucent lesions are seen involving the inner and outer tables seen in the eosinophilic granulomas. Bird beak sign. So irregularly marginated tapering of esophagus. So this is the barium swallow in which we can see the dilated proximal and distal esophagus with at the gastroesophageal junction we see the smooth tapering and gives appearance of the bird beak sign. It is seen in the achalasia cardia. So this is the image of C arm negative image where we can appreciate the proximal and distal esophagus is dilated and there is a smooth tapering of the gastroesophageal junction seen in the achalasia cardia. Bowler's hat sign. So what is Bowler's hat sign? It is a cup-shaped filling defect seen on the air contrast barium enema that represents a polyp if it points towards the lumen. And if the outpouching it point outside the lumen, then it will called as a diverticulum. So this is the Bowler's hat and it gives the appearance, polyp gives the appearance of Bowler hat sign. Bone within bone sign. So we can see the inner layer of cortical new bone within an pre-existing bone seen within the osteopetrosis and even in sickle cell disease. Boot-shaped heart. This is the boot-shaped heart and it is seen in the tetralogy of Fallot. It includes pulmonary infundibular stenosis, overriding of aorta, VSD and RVH. So what are the features of boot-shaped heart? Is the apex rotates superiorly, then pulmonary oligemia, that means bronchovascular pulmonary markings are reduced because less blood is supplied to lungs, then enlarged aortic root and the pulmonary artery segment concavity because of the pulmonary stenosis. Box-shaped heart. Squared off appearance of the heart in abstinence anomaly due to large right atrium and dilated ventricular outflow tract. Bulging fissure sign. Bulging usually of the minor fissure from heavy exudative pneumonia likely Klebsiella. So this is the pneumonia and there is a bulging of this minor fissure. It is the characteristic feature of the Klebsiella pneumonia. Bottinier's deformity, hyperextension of the DIPs and flexions of the PIPs as seen in the rheumatoid arthritis. Colon cutoff sign. So this is the transverse colon and this is the splenic flexure and from this we cannot appreciate the descending colon, sigmoid colon and the rectum because the abrupt cutoff of colonic gas from the splenic flexure, the colon usually decompressed beyond this point because of the reactive changes by the acute pancreatitis, by the peripancreatic fluid collection or fat stranding. So it gives colon cutoff sign on X-ray abdominal X-ray. Chord 1 triangle. So it is a triangular elevation of periosteum from an aggressive, usually malignant bone tumor such as osteosarcoma. Cotton wool appearance. Islands of poorly marginated sclerotic disease surrounded by less dense skull in Paget's disease. So this is the characteristic feature of cotton wool appearance is seen in the Paget's disease. Coffee bean sign. So dilated sigmoid colon and gives appearance of the coffee bean sign. So it why it is sigmoid volvulus and not cecal volvulus, because we can appreciate the large bowel loops are dilated peripherally, and the apex of the volvulus is seen in the cecal region. So that is why it is a sigmoid volvulus. If there are no dilated large bowel loops and apex is towards the sigmoid, then it is a cecal volvulus. So this is how we differentiate. So this is the characteristic sign, coffee bean sign seen in the sigmoid volvulus. Cobra head appearance. So rounded dilatations of the distal ureter surrounded by thin lucent lines seen in the patients of uretroceles. So these are the dilated outpouchings at the VUJs in the IVU, that is intravenous urography. We can appreciate uretroceles called as cobra head appearance or adder head appearance. Cobblestone appearance. So GI, that is gastrointestinal alternating normal and denuded mucosa from the ulcerations, especially Crohn's disease. So how these cobblestones appear, and this is the resemblance of the cobblestones seen in the Crohn's disease because of the multiple ulcerations seen in the Crohn's disease. Champagne glass sign, that is the squaring of the iliac wings producing a champagne glass appearance of the pelvic inlet, and it is the characteristic features of the achondroplasia. So this is the champagne glass and this is the squaring of the pelvic inlet. Crescent sign. In a case of avascular necrosis of femur head, coronal section of the femoral head segment reveals subchondral fracture, which manifests as a crescent sign. So we can appreciate on X-ray frog leg view, we can appreciate that this is the sclerotic margin of the head, which is characteristic of the avascular necrosis, and we can appreciate this thin line here. So this thin crescent line on the CT MPR image, we can appreciate this crescent sign. It is a subchondral fracture. So this is the chondroid matrix or cartilage, and then this is the subchondral fracture, that is a crescent sign seen in the subchondral fracture of the avascular necrosis. Continuous diaphragm sign, that is the visualization of the entire upper surface of the diaphragm from the pneumomediastinum, because the air which can appreciate this thin linear air which is covering the pericardium is extending in the uh, upper surface of the diaphragm. So because of that uh, air, we can appreciate the continuous diaphragm sign seen in the pneumomediastinum. Corkscrew esophagus. So this is the corkscrew esophagus in the barium swallow image, where this is the constricted twisted lumen from abnormal tertiary contractions in diffuse esophageal spasm. So it is called as corkscrew esophagus. Codfish vertebrae, biconcave shaped appearance of vertebral bodies from avascular necrosis resembling like a codfish seen in the sickle cell anemia. Then David Letterman sign, or also known as Terry Thomas sign. So as their central incisors have the gap in between, same like that, there is a widening of the distance between scaphoid and lunate more than 3 mm on PA view because of the ligament disruption. So this is the scapholunate dissociation or disruption gives appearance of David Letterman sign or Terry Thomas sign. Double bubble sign. It is a dilated stomach and the proximal duodenum in newborn, typically seen in duodenal atresia, then midgut volvulus, annular pancreas, and also in lad bands. We can appreciate it on ultrasound in ANC case also, where we can appreciate the uh, fluid filled stomach and duodenum gives double bubble sign. Deep sulcus sign. So we can see the bronchovascular markings on this side, but there are no bronchovascular markings, and the lung on left side is radiolucent, and it is gives a deep sulcus sign. It is a characteristic feature of pneumothorax. Drooping lily cell, appearance of the lower pole calyxes in duplicated collecting system with non-functioning upper pole. So we can appreciate this kidney, and this there is a double pelvic calyceal system, and we can appreciate this lower moiety gives appearance of drooping lily with the non-functioning upper pole. Dripping candle wax sign. So as we can see dripping candle wax here, we can see the cortical hyperostosis on one side of the bone likened to melting wax seen in the maloriostosis. Dagger sign, dense line caused by the ossification of supraspinous and interspinous ligaments in ankylosing spondylitis. So this is the dagger sign here. Eggshell calcification. So these are the lymph nodes which are sclerotics, and has a peripheral calcification in lymph nodes. And on coronal image of the CT scan, we can appreciate these lymph nodes with the calcifications, and these are the characteristic features seen in silicosis and also in sarcoidosis. Egg string sign. So the narrowing of the superior mediastinum and the globular shaped heart in the neonates with transposition of the great arteries. So in TGA we see egg string sign. Fallen fragment sign. So this is the humerus, and this is the shoulder joint where we can appreciate a small piece of bone is settled to dependent portion of the this is because of the pathological fracture seen in the radiolucent lesion in the proximal shaft of the humerus. So this is the unicameral bone cyst or the simple bone cyst with the fallen fragment sign within. Figure of three sign seen in the coarctation of aorta. So this is the dilated left subclavian artery. Then this is the indentation of the quart, and post-stenotic aortic dilatation forms the figure of three sign in the coarctation of aorta. Football sign. So oval-shaped lucency seen on the supine abdominal radiograph in large pneumoperitoneum, usually in infants. So this air which is covering the entire abdominal organs, so it is a pneumoperitoneum and gives appearance of football sign. Fish hooking of ureter. That is, this is the J-shaped ureter can be appreciated here. Distal ureter from enlargement of the prostate. So this is the enlarged prostate, that is benign hyperplasia of prostate, which causes the indentation on the posterior and posterior wall of bladder and gives appearance of the J shape. That is called as fish hooking of the ureter. Fish mouth vertebra, or it is gives a biconcave appearance of disc spaces in sickle cell disease from avascular necrosis of vertebral end plates resembling the fish mouth. Golden S sign. This is the S shaped caused by the edge of elevated minor fissure and hilar mass in right upper lobe atelectasis. So here hilar mass causing the atelectasis of the upper lobes gives appearance of the golden S sign. Gloved finger sign. So we can appreciate finger-like projection from the hilum of the bronchial mucoid impaction in allergic bronchopulmonary aspergillosis. Can also be seen in asthma. So it is giving appearance of the finger in glove appearance because of the mucoid impaction in the ABPA. Hair on end appearance. We can appreciate hair-like projections on the on the skull, that is speculated appearance of the elongated trabeculae in wide and diploid spaces seen in hemolytic anemia, especially thalassemia. Heel pad sign. Enlarged soft tissue of heel pad more than 23 mm is seen in the acromegaly. If it is more than 23 mm, that is heel pad sign. Honda sign. This is in the nuclear scan in the sacral insufficiency. Gives appearance of the Honda car maker's logo because of the radiotracer uptake. Honeycombing of the lung, that is clustered thick walled cystic spaces representing dilated and thickened bronchial walls. and it is seen in bronchiectasis, cystic fibrosis, also in the usual interstitial pneumonia, in the interstitial lung disease. So these are the cystic spaces with the bronchial wall thickening uh, clustered together gives appearance of the honeycombing. Hilum overlay sign. So differentiates large pulmonary artery. We can appreciate this hilum here also, and this is the hilar mass. So if it mass superimposes the hilar vessels, then it could be anterior or posterior mediastinal mass. So to locate the position of the mediastinal mass, this sign is useful. So this is a hilum overlay sign. Ivory vertebra, dense white vertebral body, essentially of normal shape, most often seen in the osteoblastic prostate CA or breast CA metastasis, also in the Paget's disease, multiple myelomas. So here we can appreciate the sclerotic vertebral bodies seen uh, in these conditions like osteoblastic prostatic or breast CM, it's Paget's multiple myelomas called as ivory vertebra. Now juxtaphrenic peak sign. It is seen in the tent-like projection is seen in the medial hemidiaphragm with upper and sometimes middle lobe atelectasis. So we can appreciate upper lobe atelectasis here. So it can be seen in the middle lobe atelectasis. J-shaped sella. So this is J-shaped sella here, and it can be seen as a normal variant or can be seen in hydrocephalus or optic chiasm gliomas. So lateral X-ray of skull, and we appreciate J-shaped cella here. Lead colon sign. So it is a characteristic feature in the ulcerative colitis. Rigid or hostile appearance of colon classically seen in the chronic ulcerative colitis. Leaked candy stick sign. This can be seen in psoriatic arthritis, rheumatoid arthritis, or leprosy also. So we can appreciate this leaked candy-like appearance here in the head of the metatarsals on the lateral end of the clavicle in rheumatoid arthritis, and even in the leprosy on the distal phalanges. Mercedes-Benz sense. We can appreciate this on MRI abdomen. Tri-radiate radiolucent shadow seen in right upper quadrant of the abdomen in the gallbladder, suggestive of gallstones. So there is also choledopolithiasis. This feeling defect is also appreciated here in the distal part of the CVD, and also tri-radiate Mercedes-Benz appearance in the gallstone. Oil droplet sign, also known as raindrop skull, multiple punched out lytic defects seen in multiple myelomas, called as oil droplet sign or raindrop skull. Pear-shaped bladder. So this is the pear-shaped bladder on the intravenous urography, shaped of urinary bladder from extrinsic compression from excessive pelvic fat, fluid, blood, urine, or adenopathy. Gives pear-shaped bladder. Picture framing vertebra. Thickened cortex of vertebral body with Paget's disease resembling as a picture frame. It is a characteristic feature of Paget's disease. Now there are other signs related to vertebrae like sandwich vertebra seen in osteopetrosis. So the normal vertebral body with the sclerotic superior and inferior end plates gives appearance of the sandwich sign. There is also Rugger jersey spine. We'll see it in further slides. It is seen in renal osteodystrophy or hyperparathyroidism. There is a sclerosis of superior and inferior end plates gives this appearance, and picture framing as we have seen in the Paget's disease, sclerosis of the corners of the vertebral body. Pseudotumor or phantom tumor. So this is the pseudotumor or phantom tumor. This is the also known as vanishing tumor because fluid in the fissure is collected, mostly seen in the congestive heart failure. Once we give diuretics, this goes away. That is why it is called a pseudotumor, phantom tumor, or vanishing tumor. So it is just that pleural effusion collects in the minor fissure, gives appearance of pseudotumor or phantom tumor, but it is not actually a tumor. It is just a collection of the fluid in the fissures. Putti kidney. It is a autonephrectomy, as we know. It is seen in the tuberculosis. Characteristic feature of tuberculosis: small shrunken kidney with dystrophic calcification with caseous and necrotic material gives appearance of the Putti kidney. Rugger jersey spine, as we have seen, it is seen in the renal osteodystrophy or hyperparathyroidism, sclerotic superior and inferior end plates of the vertebra. Rice grain calcification. So as we can see on this X-ray and even on the MPR images of the CT scan, where we can see rice grain calcification suggestive of myocystic Snowman's heart. So this is also called as figure of 8 sign. It is seen in supracardiac TAPVC because of the dilated vertical veins and SVC. Swan neck deformity. So this is the swan neck, and as we have seen the bottlenose deformity, to contrast to that, there is a hyperextension of the PIP and the flexion of the DIP gives swan neck deformity in rheumatoid arthritis. Silver fork deformity or dinner fork deformity. As we can see the appearance, there is a distal radius fracture with angulation, dorsal angulation gives this appearance. Snowstorm appearance. So what is snowstorm appearance? It is innumerable small pulmonary nodules can be appreciated on the chest X-ray. Small uniformly sized nodules in both lungs can be seen in miliary metastasis or miliary TB, fungal infections, sarcoidosis, and even in pneumoconiosis. So these are the snowstorm appearances. Even snowstorm appearance can be seen in the complete hydatiform mole. So these are the many hydropic villi which gives the ultrasound appearance of heterogeneous mass with multiple cystic spaces. So on ultrasound we can appreciate multiple cystic spaces in complete hydatiform mole. So this is gives appearance of snowstorm sign. String sign. So very thin luminal contrast, usually in the terminal ileum from the spasm and eventually fibrosis seen in the Crohn's disease. So this is the terminal ileum. This is the IC junction. So here we can appreciate a string sign of contour, as we call. It is characteristic feature of the Crohn's disease. Step ladder appearance. So loops arrange themselves from the left upper to right lower quadrant in distal small bowel. So left upper to then right lower quadrant. So this is the multiple dilated bowel loops we can appreciate in the center of the abdomen. So this is the characteristic feature of the small bowel obstruction. If they are peripherally arranged and dilated with air fluid levels, then that will be large bowel lobe obstruction. Sunburst sign. So highly aggressive speculated reaction indicating malignancy such as osteosarcoma. So we can appreciate on the AP view of distal tibiofibular joint. We can appreciate the highly aggressive mass lesion gives appearance of sunburst sign is seen in the osteosarcoma. Salt and pepper sign. Multiple small areas of resorption of skull seen in hyperparathyroidism result in mottled appearance like salt and pepper. So this is salt and pepper sign seen in the hyperparathyroidism. Thumb print sign. So we can appreciate thumb like appearances here, thumb printing. So indentation in contrast or air filled bowel lumens caused by submucosal infiltration resembling it in ischemic colitis. So thumb printing in the ischemic colitis. So thumb sign. So we can appreciate the epiglottis here, and with the soft tissue lesion can be seen on the epiglottis region, give appearance of the thumb, suggestive of epiglottitis on the lateral neck X-ray. Whereas on the AP neck X-ray, we can appreciate steeple sign or also church top sign seen in the group. Water bottle heart sign, globular shaped heart from a large pericardial effusion gives appearance of the water bottle. Thank you.